There are various breathing exercises. These breathing exercises are to be done in an open space or in a well ventilated room. You should sit comfortably in a chair with your shoulder and neck muscles relaxed. Number 1, diaphragmatic breathing. In this type of breathing, you place one hand over the abdomen, the other hand over the chest. Try to take a deep breath through your nostrils. As you are inhaling your breath through the nose, you can feel the movement of the hand over the abdomen going forward. Once you have reached the maximum capacity of your lungs, slowly exhale the air through the mouth. As you are breathing out, you can feel the movement of the hand over the abdomen going inwards. This puts some muscles of the diaphragm into contraction. Number 2, pursed lip breathing. In pursed lip breathing, you sit comfortably in a chair with your shoulder and neck muscles relaxed. Take a deep breath through your nostrils. Once you have reached the maximum capacity of your lung, breathe out through the mouth as if you are blowing out a candle. Segmental breathing. You keep your hands in this position. Take a deep breath through the nostril. As you are breathing out, you apply pressure over the apex of the lung by your hand. Coastal breathing. Keeping your hand in this position, taking a deep breath through your nostril. Once you have reached the maximum capacity, try to breathe out through the mouth. When you are breathing out, apply pressure over the sides of the chest by compressing the sides of the chest. Thoracic expansion exercises. These exercises are to be done in a standing posture. Once you are in a standing position with your arm by the side, taking a deep breath through the nostril. As you are breathing in, slowly raise your hand above the shoulder level. Once you have reached the maximum level, try to breathe through the mouth. This can be repeated 5 times. The other exercise is keeping your hand over the head, back of the head, taking a deep breath through the nostril. As you are breathing in, push your elbow backwards. Once you have reached the maximum level, slowly exhale through the mouth. As you are exhaling through the mouth, bring your elbows forward. Sitting in a standing position, slowly taking a deep breath through your nostril. As you are breathing in, slowly raise your hand above the shoulder level. Once you reach the maximum level, slowly exhale through the mouth, and as you are breathing out, slowly bring the hand down to the sides. This can be repeated 5 times. Breathe in a rectangle. Now, when you sit in a chair comfortably with your shoulder and neck muscle relaxed, you choose an object. It can be a TV monitor or a door frame or a window frame. There are two sides of the rectangle. One is the short side, the other is the long side. When you are taking in a deep breath, you move your eyes from one end of the short side to the other end of the short side. Once you have reached the end of the short side, start exhaling through the mouth. As you are exhaling through the mouth, you move your eyes from one end of the long side to the other end of the long side. It can be repeated 5 times. Breath control while walking. Now this can be done on a plain surface while you are walking or climbing stairs. When you are climbing stairs, you can use 1 step for inhalation, 1 or 2 steps for exhalation. The same thing applies for walking on a plain surface. Pranayama. Here you use the thumb and the ring and the little finger. The thumb finger for closing the right side of the nostril, the ring finger and the little finger for closing the left side of the nostril. Slowly take in deep breath through one side of the nostril by allowing air to go through a slight opening of your ring and the little finger. Once you have reached the maximum level, close that side and exhale through the other side of the nostril. This can be repeated 5 times. Incentive spirometry. This is an incentive spirometer. This is a handheld medical device used after surgery and after certain lung conditions like COPD and bronchial asthma after their exacerbations. This device will help in retraining your lung to expand the alveoli where the gas exchange takes place and improving the lung function. In post-COVID conditions, the main idea is to bring back the normalcy in the lung. This is the mouthpiece. Sitting comfortably in a chair with your shoulder and neck muscle relaxed. You keep your mouthpiece inside your mouth, completely sealing the mouthpiece. Take in deep breath, slowly and steadily, and as you are taking a deep breath, you can see the colored balls going up the tubes. Hold the breath for a few seconds, 1 or 2 seconds. Then once you take out the mouthpiece, the colored balls will drop down to the bottom. This can be repeated. This frequency by which this repetition is to be done is to be decided by the health condition of the patient and on the advice of the treating physician. This should not be done after any eye surgery or in patient who have had aneurysm or swelling of the arteries in the abdomen or brain and any other situations. And I would like to thank my family, my wife and my sons for preparing this video and helping me, and also Mr. Saktivel and his colleagues at the Aeroforce Division of Zydus Healthcare Chennai for providing me the incentive spirometer. Thank you. Stay safe.